the City Biz Show. I am honored and privileged today to be your guest host. My name is Aurea McGarry, and I have the privilege also today of bringing you a phenomenal guest. Tom Graham is not only a serial entrepreneur and the CEO of Life Imaging based in Florida, he is revolutionizing saving lives and early detection. And it's a great honor to bring Tom Graham onto the show. Welcome, Tom.
Hey, I'm so happy to be here and so happy to be able to talk to everybody about this exciting technology and what we have to offer to everybody here in Florida and South Florida in particular. Thank you.
Oh, Tom, I can't wait for you to tell them what this is. I heard about you through the grapevine during the pandemic. I mean, good news, travels quickly. And I have that, as a high risk person, they took out the lining around my heart and many other organs during my cancer. And our mutual friend was telling us about you. And I'm so glad to reconnect. So tell us a little bit about your background and what leads you to this phenomenal life imaging.
Yeah, so I guess what we would call a serial entrepreneur. I've owned businesses most of my adult life. I stumbled into the medical field. It was really kind of crazy the way it happened. I had one of my employees that worked for me for a long time, over I don't know 10 or 15 year period. I lost track of her. She reached out to my assistant through Facebook, and then we got reacquainted, and I found out she was running a program similar to this up in another state. One of the few people in the country that do this, and I lost both of my parents to cancer, right? And I'm now what I would consider to be, I'm a baby boomer. So, you don't realize how much it weighs on your brain about this cancer and heart disease because we all have these personal exposures to it, right? I lost my mother at a very young age. It was very impactful on me, and then my father later in life. And so when I found out that you could even do this, it blew me away. And that's why I went on this mission to do good on the planet, to try to help as many people as I can and get the word out as largely as I can. I'm exposing as everybody I can in South Florida. As we run a big campaign and we offer these free heart scans. But I got into the business just I'm a big believer in the secret. If you want to make God laugh, tell him your plans. If you if you would have told me I was going to be in the heart and cancer business 3 years ago, I'd have probably laughed at you. But here we are.
And what exactly is life imaging? I know you're talking about the heart. So walk us through what this is and what early detection it actually does for us. Because this is really exciting, especially after the pandemic when the heart issue was a really big, key component of COVID.
Yeah, that's right. And we can see it on people that come through. So we use state of the art low dose CT technology. My equipment is made by General Electric. I'm sure you've heard of that small company. Yeah, so we've got a low dose, state of the art CT scanner. CTs are normally used when something's wrong and the doctor wants to look inside you, right? But what people don't know is I can use that same technology and I can look inside of you. I can check all of your organs. We actually create a 3D image of the organ, and then we're able to slice it very thinly and look in the slices. I can find some cancers a decade ahead, smaller than a grain of rice. With heart disease, we do what's called calcium scores of the heart. It's really the only true way to learn about blockage inside of the arteries. And we can see the blockage in the arteries, and we can find aneurysms, valve issues, any kind of problems in and around the heart with 98% accuracy. The crazy part is, heart disease is the number one killer of people on the planet. 1 out of 3 of us die of heart disease. I'm almost convinced cancer gets the rest of us. So, with if I can do the heart disease and the cancer, the two biggest killers on the planet, and keep you ahead of it, it's a bit of a no-brainer. So that's how we do. We use this technology. And I said normally because medicine is reactive, right? Docs are taught to be reactive. You don't normally do this until something's wrong. But I can use the same technology and do as I described, get ahead of these two biggest killers. It's pretty amazing stuff.
So with that, you're talking about the heart. Does it also do other organs in the body? And is this something that's covered by insurance or self-pay?
So it's normally self-pay, it's a shame. And, I get Believe me, I've learned a lot, but I've talked to a lot of doctors, and they tell me, Tom, it's just not in our DNA. We're taught to be reactive, and insurance doesn't pay for this preventative screening. I know it doesn't make sense to anybody, doesn't make sense to me either, but I can't right that ship. That's a big ship to turn around, between big pharma and doctors. And look, doctors are amazing. They're great people, but if you think about it, they don't make much money keeping us healthy.
Yeah, I just saw that show on Netflix, and it was a really great show about how to live to 100. And all those, you probably saw it. All those places had a few things in common, and one of them is that they really worked on preventing illness. Their lifestyle prevented illness. And in America, we're such a wealthy, country, and we're all about trying to cure the sick and medicine and all of that. When other countries, small, poor, whatever, there's so much healthy, they live past 100. So talk to us about what it would cost, because I'm with you. I spend, I don't have insurance. Being an entrepreneur, I have always done self-pay, and I'm able to do what I want to do with that. So tell us what the cost would be for this so people can jump in.
Yeah, well, listen, we found the best way I could to make it affordable for everybody, and we've done that. In the last 24 months since we opened, we've scanned 17,000 people. So it's a pretty big number. We've saved countless lives. So, on the preventative side, we're involved with a little bit of research that sort of co-pays with some of this stuff. So we offer free heart scans to everyone. The heart scans are valued at $699 as part of a get to know you kind of offering and a way to get people in. I have to kind of bring people in the best I can because people need to get educated. So you can come in and get a free heart scan from us and then sit down with one of my patient advocates. They'll go over the full body cancer screening and the full body cancer screening. So I'll break it down quickly. If the hospital was to build the insurance company, a full body scan would probably be about $20,000. If you go and you buy one retail and you try to find somebody, the problem is nobody does them because doctors don't write scripts for them. They only put you on the machine if something's wrong. They want to look at a specific organ because there's a problem. But I do full body scans. We do chest, pelvis, and abdomen. We look at all the organs. We look inside bone. I can see through bone. We can see inside of the bone. We can do bone density. I even do virtual colonographies, so you don't have to go get sedated and spend all day getting a colonoscopy. I can inflate the colon and takes images inside of the colon and outside of the colon with very high accuracy. So it's pretty amazing. So in terms of
Well, now you tell me. I just had one of those. Next time, though, I'll get you on the next time around.
well, look, there it is. I got to get the word out. So that's one of the reasons we love to talk to people like you is we can get the message out to everybody. If everybody knew what I knew, there'd be a line to the interstate every day, and there almost is. I mean, we're very busy here. I scanned 61 people last Saturday, so it's a busy place because of what we do. But listen, when they come in, they can go through, sit down with one of my patient advocates. They can learn more about the cancer screening process, and we can tell you how much research money we can apply, and we literally get it down to $400 or $500 a scan. So yeah, it's very affordable for everybody.
And it's a lot more affordable than chemo and trying to, fix yourself after you're broken. I'm a big advocate in preventing illness at every step of this stage. So, talk to us too about what is we come in for that free heart scan. What is that actually going to tell us in a heart scan? What is break that down a little bit for us?
Yeah, it'll tell you how much blockage you have in the arteries and where the blockage is. That's again the problem with the heart attacks is they're asymptomatic. You don't know a lot of times till you have a heart attack, and that's the unfortunate side. If it's in the widowmaker, the main artery of the heart, the LAD in the heart, it's deadly. So you have to be careful when it comes to the heart. So we can see it, the blockage, which arteries the blockage is in. We can see aneurysms in and around the heart. We can look at the valves and see if the valves are operating properly. There's a lot of things that we can see around the heart, and it's very accurate, and we don't miss much. Like I said, if you go to the website or you come in, we have a wall of life in our lobby of life-saving stories from people literally the first couple of months, and I ran out of room on the wall. I mean, that's how significant it is. We impacted 17 lives last week. So some people Yeah, I mean, literally, some people come through and they're so blocked. They think it's getting old. They think it's age, but it's because you're not circulating properly in the heart. And sometimes I have to call somebody and say, "Listen, don't get on a bike. Don't walk up the stairs. You need to relax until you can get to your primary care physician or the cardiologist and take the next steps to do some further testing to see what might need to happen." And listen, the alternative is not good. The alternative could be sudden death. So if you got to go and maybe have some a stent or two put in, sometimes people have to go as far as have open heart surgery. Nobody wants to go through that, but at least you get to go to the grandkids' wedding now, right?
Exactly, catch it in time. So many people, I find men especially, are so afraid to go because they're afraid of what they'll find out. But women, we want to know. You'll tell us. We want the advance notice. So when they come, go ahead.
So what a lot of women don't know is heart disease kills more women than all cancers combined. It's not just the killer of the husband, but you're right. You do not want to keep your head in the sand on this one. You want to know. The alternative is you find something that could be deadly that you need to fix. You find something that's not so deadly, but hey, we got to take care of it, make sure we get ahead of it. Or hey, you get peace of mind knowing I don't have anything lurking in me that's going to hurt me or kill me, and I can go with about my life, which is the process I went through and why I got in the business. You can imagine both my parents dying of cancer. I have another relative died of cancer. I go and get scanned. I'm all nervous, worried to death. Everything came back what's called unremarkable. No early signs of cancer in my organs or my body. I get to go live life now, right? Then I'll come in and we have a program where people can buy into screenings. We have a program where people can buy into screenings over multiple years. You know, the idea is as we get older, that's when what? The wheels can come off. So if I can screen you over 3, 5, 7, and 10 years of screening and make sure nothing's going to sneak up on you and give you that peace of mind, it's a beautiful thing.
You know, you brought up a good point. I was going to ask you, does anybody get like a clean bill of health? Because we don't want to scare them that everybody that comes in, you know, that. So you're right. It's that peace of mind. So tell us, what is a good age to come in and start this process to have like a baseline?
Yeah, there you go. Anything between like 40 and 75 is a perfect age group that needs to come in here and get scanned. And to answer your question, look, 80% of the people that come through are fine. 80% of the people that come through get get the peace of mind, knowing they're in good health, their heart's good, there's nothing lurking in there that's going to, cause sudden death or anything like that. And so, a high percentage of people are fine. And we have so many, listen, I have a fun atmosphere in my office. It's kind of serious, but I have my golden doodle Elvis that runs around the building. Sometimes there'll be a little tenseness in the lobby. I turn him loose in the lobby and everybody melts and the whole place gets fun and everybody's fine. And it's a great environment.
Therapy dog. Hey, I got one with me. At least yours is more quiet than mine is right now. I love that.
Yeah, yeah, no, it's okay. He'll probably jump up here in a minute. Everybody will get to see him. As a matter of fact, I'll show everybody before we go, Elvis. But listen, the other thing too about the screening is everybody needs to know there's no injections. It's non-invasive. There's no dyes or contrast. You get to keep your clothes on. You're on the machine for the maximum of about 7 minutes. You're in and out in no time.
So how do you stay? You say you kind of were thrown into the medical world a couple of years ago. How does somebody get thrown into the medical world? Tell us how you're keeping up with innovation and what the future looks like for this.
Yeah, well, listen, it is evolving, and like I mentioned to you, the virtual colonography is something we just added in the last couple of years. This ability to do colonographies on the machine with images, rather than the full, camera, the whole thing that goes on there. So yeah, me too, a couple times, yeah. I mean, look, you get yeah, that's right. So that's one of the things that we're doing now that I'm real happy about. And then the other thing is, AI. AI is coming, and AI is creating much more efficiency and much more, I guess, exact results when it comes to reading these scans than humans. So the AI component is definitely coming into play. I'm worried about the radiologists and them having a job in 10 years because
Are you serious? So AI is going to be reading these more accurately than a human.
yeah, they've already done some tests in Sweden and some other countries, and the results are better than the humans that are reading this. I'm not in any hurry to get there. It doesn't matter to me. I'm happy to have my team of radiologists, and I have highly trained radiologists that read these scans. So that's good. But you ask about the technology. I think that's about it. The machines are ever evolving, but I have what's called Acer software on my machine. It's low dose. It used to be with CTs back in the day. The issue was radiation, and they've come such a long way. You get more radiation walking around on the planet than you do on these machines, and so it's kind of a non-issue now. So don't have to worry about that.
So what is it when you say the difference between a life imaging scan and we've had colonoscopies, you're saying colonography. What is the key difference in that?
Well, the colonography is done with a camera, right? My colonography is done with X-rays, and so the way the machine works is the X-ray normally goes straight through your body, right? When you get an X-ray, it used to be you stand there and the machine shoots an X-ray through your body, and it can see through the X-ray, but only from one angle. On our machine, it's like you've seen them, CTs, MRIs, they have a donut, right? Well, inside of that donut, the machine is spinning very quickly. The table feeds you in and out of the donut, and you only go in up to here. You don't go in all the way, and it's no enclosure. You're always seeing the roof, so it's not like you're enclosed. But that is what creates. It's like a 3D printer now. So now the images are 3D, and we can create this 3D organ that we slice and look in all the slices to look down in the organs. And like I said, CTs can see through bone too. So we can do bone density and we can look for other issues inside of the bone.
This is just incredible. As a cancer thriver myself, I've had it all from a PET scan to a CT scan. Thank you.
I know. Bless your heart. I know, honey. Bless your heart. I'm glad you're doing well. You look beautiful. You look happy. And, hey, yeah, I'm so happy for you. People realize, and like I said, we all have our own personal experiences, but the moment you don't have your health, it becomes a whole different world. It's just crazy. Yeah.
It really does. And I appreciate you so much because I want to ask you another question because ever since getting diagnosed in 99 with the cancer and having to go through all of that, chemo, anything to do to stay away from chemo, I'm an advocate for because that alone kills you before the cancer many times. It was just horrible for me. And so after that, I went into vitamin therapy. I did everything from coffee enemas to chelation treatment. So when you get a diagnosis, when you find something wrong, what is your next step for the patient? Do you send them to a doctor? Do you refer them to chelation treatment? What is the next step should you find something? What do you then tell them?
Well, so when someone comes in, they're going to get their report from the radiologist, but they also go home with a disc with about 900 images of their body. So if we find something, they now have that disc to take to their primary care physician or take to the cardiologist, to take to the doctor that they want to go to and present the images so the doctor can see it along with the report. So our job is to get the information to the primary care physician, or if they want to go to a cardiologist. I'm working with a couple good, really good doctors. Like, for instance, one of the doctors I'm referring people to now is out of Holy Cross. His name is Dr. Lee. He's been studying calcium in the body for 30 years. He's an expert on calcium in the body, and he's actually developed a protocol to help remove the buildup inside of the arteries from diet and medications, and it's working. And he believes too there could be a correlation between lung nodules. Everybody talks about nodules on the lungs and cancer. And so he's a guy that believes in what we do, and he sends patients over all the time. And he's very good. Like, he'll send someone over and he says, Tom, he's probably going to have a high calcium score. And sure enough, they'll have a high calcium score. So there's a couple doctors that I do work with that are on that level that do things. And we have a radiologist, Perloff, who's on the governor's board of cardiology, and he's someone I use to refer people to. A lot of people don't have a cardiologist till they need one, right? Normally, their primary care physician will do it, but yeah, they'll get them right to their doc and move forward from there.
And I love what you said that you have a few doctors you're working with because my next thought was the way you work with doctors to send the patients once they get a diagnosis or the scan shows something, you send them where they need to go to the doctor. And I wish more doctors would, before they start cutting open or just prescribing medicine, whatever, should send them to you first. So if you had that wonderful marriage of they send them to you, find out really what's wrong, but we know there's not money in it for them, for pharmaceuticals, the whole 9 yards, another conversation. But it would work so hand in hand. So now you're in Florida, though, Tom. What if somebody's watching the show? They're not in Florida. They can never get to Florida. What can they do? Is there more of these opening up in the U.S. or around the world? Tell us the future of location as well.
Yeah. Well, we just opened Orlando, and I just went yesterday. I'm scouting an office up in Jupiter, Port St. Lucie area next. I have to be about, two hours away or so because everything overlaps in the marketing. I'm on TV and radio a lot. So, but right now we're in Orlando. We're here in South Florida in Deerfield Beach, and then we're going to be up in Jupiter. I'm going to end up in Jacksonville, probably Sarasota, probably Fort Myers. So the state will be covered. After that, we are considering a program we're going to open up across the country in different markets around the U.S. But listen, I have people flying from out of state. I had a guy come over from the Bahamas. We get people driving from across the state just because they can't get anywhere to do it. A lot of people tell me their frustration with their doctor. In all fairness to doctors and what you said a minute ago, doctors always do that. If they find something wrong, they do send people out for further testing. They may not send them to me. My technology is nothing. I don't own it. It's not proprietary. It's how we use the technology that makes it different, for this preventive. Nobody does it because insurance doesn't pay for it and nobody knows how to get paid. So we've developed this whole program to bring people in, as I described to you, to make it affordable, to get everybody in here we can, because it's such an important topic and it's such an important thing in life. And like I said, if everybody knew what I knew, they'd be here every day knocking on the door. But I'm getting the message out to everybody I can. But hopefully, in the near future, we'll be in a city near you. you know, you know, that's the idea.
Yes, you better be. I'm right up here in the Atlanta area. Move on up. You're almost there. So,
Yeah, yeah. Or come to Florida and have a great 3 day, 2 night getaway on the beach and get a life scan and make sure you're okay, right? What a great. I'm going to start promoting it on. Yeah. Oh, you're in St. Pete? Oh, oh, yeah. I should start putting ads in the magazines on airplanes.
you should, all sorts of places. So, all right, so people are now watching the show at this fabulous City Biz. So let's say again, they might be in California, Texas, Canada, somewhere else, and Florida is just not in their scope. How can they get a hold of you? Do you have a show, a podcast? You have a website? And there's no, and if they're able to get on a plane, great. But let's say they can't. Is there something advice you can give them to look for something similar in their area, or should they just get on that plane and get to Florida no matter what and do this what? Once a year, every 5 years?
Sure you're okay and nothing's sneaking up on you. In regards to getting it done, you could try to go to your primary care physician and just tell him you want to get a full body scan to make sure you're okay. But I'm a little discouraged by what I've learned about that. Most doctors are saying you're fine, you don't need that, but sometimes you can do it. Sometimes you can force the issue. I guess if you walk into a radiologist's office and to ask to do it, but it's kind of difficult to be honest. So if anybody wants to come in and do a nice 3 day, 2 weekend in South Florida and get scanned, they could call the office at 954-834-6362 and just tell them you want to come in and get a full body, and we can book them in. I can help them with arrangements, place to stay. We've got a couple beautiful little resorts right here in Deerfield Beach. I could stay on the water, and it's about an 8 minute drive to our facility and get this done and enjoy themselves. My website is lifeimagingfla.com. Lifeimagingfla.com. They can go on there and read about some of the stories and get some more information about all the things that we can find. We have a list of lots of disease, lots of ailments that we can see through this technology. And I'm happy to help anybody I can.
How does this compare to several years ago? Like I said, I've always been proactive since my diagnosis, which was 23 years ago now. And I stay up on all this. That's why our mutual friend said, Ray, you got to know Tom. Um, how does this relate to back in the day, maybe 5 or 8 years ago? I had one of those heat imaging. How does it relate to the heat imaging? Are those compatible?
Yeah, it's not as thorough, but I guess it would be a place to start. It's like a sonogram too. You do sonograms of the arteries, the carotid arteries they do, and different sonograms that can start to see things, but it's not near as thorough and as clear as us. If you saw the images that we create on these machines, you'd be blow you away. I can see, the smallest of kidney stones, the smallest of nodules inside of the body. That stuff would never
This
see.
is exciting. This is what I've always wanted. I think Oprah back in the day also talked about some kind of full body image. And I always wish, can't we just go in and get fully scanned instead of this scan and that scan, and then you can't get a scan, and then you really want to know what's going on. And the worst mistake you can make is if you're not in pain, nothing's wrong, because many ailments have no symptoms until it's too late. So you are a godsend. So excited to hear about you. I'm so glad you came on City Biz Show to let more people know about this. So I want you to give us some parting words as we close up before we see your beautiful therapy dog in the background. If you could leave us with any tip for our health, what would that be, Tom?
Well, I would just say, please pay attention to what I'm saying. It's not, it's not me, it's the technology. I'm just kind of the delivery of this technology in this fashion. But if I could tell you anything, please pay attention and know that this is very effective and works very well. There's plenty of proof on the website and my letters. We're a very busy company. I'm not here. I'm here to save lives. I was semi-retired when I got in the business, and it's about saving lives for me. I want everybody to go to the grandkids' wedding. I want everybody to live as long as you can. And, even for myself, like I said, what I went through with my parents, it's really heartfelt to see what we do here. And I think everybody would enjoy the experience. It's a great office. It's a lot of fun. And we get you in and out very quickly. So the main thing is just listen, pay attention, because this is very important stuff.
It really is, Tom. And what do you have to lose? And worth the investment. Instead, we spend a lot on our exercise, our gyms, maybe vitamins, protein shakes, all this stuff. That if we just go to just make sure everything's working and get a baseline, I think it's so vital because it can save lives. Because I've lost too many people. I lost my mom too early to cancer as well, and they just find it so late too many times and heart disease, like you said. So show us your fabulous, wonderful companion there, because I think animals bring us such joy. They de-stress us. I'm a huge dog lover. Let's go. What's his name?
Come on, this would be this is Elvis. Say hi, Elvis. Yeah, he
Elvis. I love the name. Elvis is worth the trip all by himself.
yeah, yeah, he'll give you some love, and he'll be conducting your X-ray, your CT when you get here. So don't worry, you'll be in good paws.
You'll be in good paws. I love that. Therapy animals are so de-stressing. Thank you, Tom, so much. You know, I'm going to take a weekend there. You will be seeing me and my family because nothing to lose. Actually, you don't even have a life to lose because it's going to make you live longer by knowing. So knowledge is power. And this is beautiful, Tom.
Yeah, well, yeah. Thank you for having the opportunity to get this to some more people. And listen, if you don't do it for yourself, do it for your loved ones, please.
Absolutely, Tom. Well spoken. Thank you for being on the show. Thank you all for watching another episode of City Biz. I'm Aurea McGarry. Until next time, have a great day. Thank you again, Tom.
All right, God bless. Thank you.